Good evening, everybody. Welcome to Dr. Ismail Easy Lectures. In today's class, let us try to discuss some basic important questions from adrenergic agonist drugs. Yesterday, we have seen some basic concepts about receptors, adrenergic receptors, and what happens if adrenergic receptors are activated on different tissues. In today's class, let us try to learn about the drugs on different tissues. Let's begin the session now. Let's go with first question. Let me read out the first question. The following drugs are used in acute bronchial asthma through beta 2 activity, except. So, which of the following drugs are used in bronchial asthma except is the question. So, in the options we have terbutaline, salmeterol, noradrenaline, formoterol, and salbutamol. So these are different options. So among these following, which drug is having which drug is used in bronchial asthma with beta 2 activity? Actually, in bronchial asthma, the drug should act on beta 2 receptors because beta 2 receptors are present on lungs. On the lungs, we have beta 2 receptors, especially on the bronchial smooth muscles, and when beta 2 receptors are activated, it will relax the bronchioles, and by that it will increase the inhalation to the patient. It decreases shortness of breath. So among the following, which one of the drug is not used in acute bronchial asthma is the question. So to solve this, to understand this, let me tell you some basic concepts, some important drugs in adrenergic system. So the first drug in adrenergic agonist is adrenaline. Adrenaline acts on alpha 1, alpha 2, beta 1, beta 2, beta 3. So adrenaline acts on alpha receptors and also on beta receptors, and it also acts on beta 2. So adrenaline can be used in bronchial asthma, but in the option we don't have adrenaline. Yes. And the second drug is noradrenaline. Noradrenaline is acting on alpha 1, alpha 2, and beta 1. But noradrenaline is not acting on beta 2 receptors. This is very important. So noradrenaline is not acting on beta 2. It is acting only on alpha 1, alpha 2, and beta 1. Because beta 2 activity is leading to bronchodilation, but here it is not acting on beta 2 receptors. Next option is the next drug is isoprenaline. Isoprenaline acts on beta 1, beta 2. Dobutamine acts especially on beta 1. Salbutamol, terbutaline, salmeterol, formoterol, all these drugs will act particularly on beta 2, and through that specific action, they are particularly used in bronchial asthma. And we have phenylephrine, methoxamine, which are selective alpha 1 agonist. We have nafazolin, oxymetazoline, xylometazoline, which are having both alpha 1 and alpha 2 actions. We have clonidine and methyl dopa, which has alpha 2 actions, particularly alpha 2 action. This is very important. And apraclonidine and bromidine are again alpha 2 blockers, but these drugs are not used orally. They are used topically, especially in glaucoma, in a glaucoma condition. Even this is also expected one. And we have amphetamines, methamphetamines, and methylphenidine. So these drugs will centrally, indirectly they'll act and they'll increase the release of noradrenaline. They'll not directly act on receptors. So there is no role with the first question. And we have ephedrine. Ephedrine acts on alpha 1, alpha 2, beta 1, beta 2. And dopamine acts on alpha 1, alpha 2, beta 1, and dopamine 1 receptors. Anyways, so these are the different drugs in sympathetic system and their different receptors, how they act on the different tissues. So in the first question, what he is asking is, in the first question, which one of the following drugs are used in bronchial asthma through beta 2 activity except? See, terbutaline is a beta 2 agonist, solmetrol is beta 2 agonist, formoterol is beta 2 agonist, and salbutamol is also beta 2 agonist. But here noradrenaline is not beta 2 agonist. So except these drugs, except C, except noradrenaline, all other drugs are used in bronchial asthma. So the correct option in question 1 is C. Clear? Now we'll go to the second question. Beta 2 agonist causes the following adverse drug reactions. As I told, beta 2 receptors are present on lungs. Along with lungs, beta 2 receptors are also present on different other cells. The options for this question is beta 2 agonist causes tremors, hyperglycemia, hypokalemia, all the above, none of the above. So to solve this, see, in yesterday's class I was telling you beta 2 receptors are present on liver. On liver, if beta 2 receptors are activated, it causes hyperglycemia. Simple. On skeletal muscles, if it is activated, it causes skeletal muscle contraction and it leads to tremors. हाथ पैर पूरे कांपते रहते, tremors will be there, shaky hands and shaky legs. Ciliary epithelium of eyes causes increased secretion of aqueous humor. This is we have seen yesterday. And one more point, on every cells, when beta 2 receptors are activated, it will uptake potassium into the cells and it causes hypokalemia. And on bronchioles, it relaxes and it is helpful in asthma. And on in uterus, it relaxes the uterus and it stops the premature. It stops in labor conditions. It decreases labor. And in bladder smooth muscles, again it relaxes and it stops the urine output. And in GI smooth muscles, again it relaxes GI smooth muscles and it reduces defecation. So urine output decreases in bladder smooth muscles and it causes constipation on the GI smooth muscles. I think these are different points we have already discussed. So on bronchioles, beta 2 receptors causes bronchodilation. On uterus, it causes relaxation. On skeletal muscles, it causes tremors. This is one adverse effect. When beta 2 agonist is given, patient may develop tremors. And when beta 2 agonist is given, patient may develop hypokalemia. And on liver, when beta 2 receptor is activated, it will develop hyperglycemia. It will increase glucose levels. So tremors, hypokalemia, and hyperglycemia. These three are common adverse effects with beta 2 agonist. So here, beta 2 agonist causes following adverse effects. It causes tremors, yes. It causes hyperglycemia, yes. It increases glucose levels. It causes hypokalemia, yes. And the fourth option is all the above. So answer D is correct for question 2. Now we'll go to the third question. Advantages of adding adrenaline with the local anesthesia. See, when local anesthesia is given in local surgery conditions like dental surgeries or dermal surgeries or any particular tissue surgeries, local anesthesia is given. Along with local anesthesia, adrenaline is added. So why adrenaline is added with local anesthesia is the question. So in that options we have adrenaline will slow down the absorption from the local site, which results in prolonged duration of action of local anesthesia. Yes. See, what adrenaline does is adrenaline will stimulate alpha 1 and alpha 2 receptors. Alpha 1 and alpha 2 receptors are present on blood vessels. When these alpha 1 and alpha 2 receptors are activated, it will constrict the blood vessels. And when blood vessels are constricted, the local anesthesia which is given here, it will slowly diffuse into the tissues, and by that it increases the duration of action of local anesthesia. So duration of action of local anesthesia is increased when adrenaline is added. This is one advantage. And the second one, it adrenaline decreases bleeding in the surgical site. Yes, when adrenaline acts on alpha 1 and alpha 2, it constricts all blood vessels, and when blood vessels are constricted, obviously bleeding will decrease in the patient. So in surgeries, bleeding कम करने के लिए adrenaline is also added along with anesthesia. This is second advantage. And third advantage is it will slow the absorption of local anesthesia, and which reduces systemic toxicity. See, when local anesthesia is given from the blood vessels, if the local anesthesia enters into the circulation, so it may cause systemic actions, it may cause systemic toxicity. So, due to the vasoconstriction, it will not allow the local anesthesia to enter into the other tissues. Even that is also one advantage with adrenaline when it is added along with anesthesia, especially local anesthesia. So this is the third advantage. So the option for this third question is option D, because these three are advantages when adrenaline is added with local anesthesia. So option D is correct, all the above. I'm sorry. Now we'll go with the fourth question. Which of the following drug is used as oral nasal decongestant? This is very important. See, we have pseudoephedrine, nafazolin, xylmetazolin, and oxymetazoline. I was telling you one mnemonic, simple NOx. NOx or nasal decongestants which are given topically in the nasal cavity as nasal drops or nasal spray. Nasal drops and nasal spray. Nafazolin, xylmetazolin, and oxymetazoline. And here pseudoephedrine is given particularly through oral route, through tablets. It is available as tablets. So here, which of the following drug is used as oral nasal decongestant? Oral nasal decongestant tablet is pseudoephedrine. Simple. Remaining nafazolin, xylmetazolin, and oxymetazoline are available in topical form. And the next question, which of the following alpha 2 adrenergic agonist has antihypertensive effect? This is very, very, very important question. See, all adrenergic agonist will increase directly or indirectly, they'll increase blood pressure by acting on alpha 1, alpha 2, or by acting on beta 1 particularly. So here, which of the following alpha 2 adrenergic agonist has an antihypertensive effect? Actually, adrenergic drugs are causing hypertension, but sometimes adrenergic drug also will decrease hypertension. So which one of that drug decreases hypertension is the question. So in that we have alpha methyl dopa, adrenaline, noradrenaline, and none of the above. See, alpha methyl dopa is the answer for this question. Why? Because alpha methyl dopa is given as prodrug. Actually, alpha methyl dopa is available in prodrug form. This prodrug enters into the sympathetic nerves and it will block alpha 2 activity. When alpha 2 activity, it stimulates alpha 2 receptors. When alpha 2 receptors are stimulated, in last class I told, it will decrease the further release of adrenaline, noradrenaline. It will decrease the release of noradrenaline. Through that, it will decrease blood pressure. So alpha methyl dopa and clonidine, we also have a drug called clonidine. So alpha methyl dopa and clonidine are two drugs which will act on alpha 2 receptors, and they'll decrease the release of noradrenaline in the brain. But here adrenaline is direct alpha 1 and alpha 2 stimulator. It constricts the blood vessels and increases blood pressure. Noradrenaline also same, it increases blood pressure. So answer A is correct with fifth question. I'll give you clarity here. You see, when alpha methyl dopa is given, actually alpha methyl dopa is available in prodrug form, and this alpha methyl dopa and clonidine both are drug of choice in pregnancy because they don't have other direct actions, teratogenic actions. Alpha methyl dopa enters into the blood brain barrier and it is converted into alpha methyl dopamine. Alpha methyl dopamine is active form. Alpha methyl dopamine will release alpha methyl noradrenaline, and this alpha methyl noradrenaline will stimulate alpha 2 receptors, and by that it decreases the release of noradrenaline. And when noradrenaline release is decreased, it will decrease heart rate, it will decrease peripheral resistance, and it will decrease blood pressure. So it is having antihypertensive action. Actually, it is adrenergic drug only. It is sympathomimetic drug only. All sympathomimetic drugs will increase blood pressure except methyl alpha methyl dopa and clonidine. You have to remember this point. This is the special point about sympathomimetic drug. I think this fifth question is clear to you all. Now the next question: which of the sympathomimetic drug promotes weight loss? Sympathomimetic drugs, they are not only stimulating alpha 1, alpha 2, beta 1, beta 2, beta 3 receptors, and but along with that actions, sympathomimetic drugs also will cause weight loss. So the drugs which will decrease weight loss or the drugs which will inhibit appetite are called anorexia bolte हैं, anorexia. So, which one of the sympathomimetic drug is used as anorexiant is the question. So, here in the options we have mazindol, phentermine, sibutramine, and all the above. So, I'll give you clarity. See, these are three drugs actually which are used as anorexiants. Anorog, anorexia, anorectics भी बोल सकते हैं. So these drugs are actually amphetamine-like drugs. They are amphetamine analogs. In that examples, we have mazindol, phentermine. Mazindol and phentermine will inhibit the reuptake of noradrenaline, and they'll enhance the noradrenergic transmission in the brain, and by that it inhibits the hypothalamic feeding center and it suppresses appetite. Bhook nahi lagti. When mazindol and phentermine drugs are taken, it will suppress appetite. And sibutramine is another amphetamine-like drug, which is a sympathomimetic drug, which inhibits same noradrenaline and 5-hydroxytryptamine reuptake. Actually, it will inhibit the reuptake of noradrenaline. Actually, when noradrenaline is released in the synapse, it should enter back into the presynaptic nerve through reuptake mechanism. And these drugs, mazindol, phentermine, and sibutramine, what they are doing is they are decreasing the reuptake, and by that they are suppressing appetite. Okay, so mazindol, phentermine, sibutramine, SPM or MPS, कैसा भी याद रख लो. And the main adverse effect of these drugs are addiction property because they are amphetamine-like drugs. Amphetamines will directly act on brain. They'll cause blood pressure because they are sympathomimetics, because they are increasing noradrenaline action. They'll cause palpitations, heart rate, heartbeat will be increased, and sleep disturbances is very important. When these drugs are given, all sympathomimetic drugs, particularly amphetamine-like drugs, when they are given, they will cause insomnia. नींद नहीं आती patient को. Insomnia is seen, and sometimes depression and dry mouth is common because they are increasing noradrenaline activity. So here, mazindol, phentermine, and sibutramine. So these three are common drugs which are used as anorexiants which will promote weight loss. So here all the above is the answer. Actually, I am making very easy questions just to understand all these points. I am making it easy, but in Gpat examinations they'll ask in different way. They'll try to confuse. So all these lectures are just to make you understand because theoretically if I take classes, it will take a lot of time. So I am taking theory as well as questions in the same question. So just to minimize the time consumption, I am making PPTs like this. I think you all are understanding what I am teaching. So that's it for today, and tomorrow I'll try to come with some other concepts. Like in tomorrow's lecture, I'll discuss about beta blockers and alpha blockers, which is very important, and from that we can expect questions in the Gpat exam. Thank you for today. Thank you for joining. We'll meet in the next class.